Hi, this is Dr. Marc Bloomenstein from the Schwartz Laser Eye Center here in Scottsdale, Arizona. Just want everybody to know in June, it's not summertime, but here for us, it's 112 degrees. So we're enjoying it. Hope wherever you are, you're enjoying it as well. I want to talk a little bit about our need to do ocular wellness. And I think that's going to be a pervasive, important message that you're going to hear throughout probably the next decade. And the reason being is that us as optometrists, the critical goal that we have is to help preserve our patient's vision and prevent conditions from getting worse. And I think one of the things that we really have to focus on is that thin little layer that we call the ocular surface. And I think more importantly is finding ways to help our patients kind of, I guess, stay in their contacts longer or have better vision through their glasses that they're going to have. And I think, we talk a lot about using artificial tears. We talk also a lot about lid control and managing the blepharitis or the debris. But I also think, there's other avenues that we have to kind of keep in mind. I am a huge supporter of cyclosporin, but I also realize some of its limitations. And some of those are that patients just don't have affordable insurance, or more importantly, the notion of putting drops in. And that's where I think punctal plugs have to come in, to the forefront of thought process. We've had patients coming in, for refractive surgery who feel they can't wear their contacts as well, and it kind of dawned on me that, how would contact lenses work with punctal plugs? Would we be able to see an improvement in the quality of our patient's vision? Would we be able to see them maybe even staying in their contact lenses longer? So in the article that you saw here in Optometry Times, I talked about a study that we did in our practice. It was a small little sample study, but what it showed us is that by using plugs with our contact lens patients, we actually were able to increase visual acuity. We improved patient comfort, and more importantly, we were able to increase patient wear time with their contact lenses. Now, punctal plugs do have a little bit of a drawback, and there was a study that was done by Steve Flufelder, almost 15 years ago, and I think what he indicated is that there was an increase in inflammation when you put a plug in, which kind of goes back to our thought process here about dry eye. When the eyes are a little inflamed, they're a little dry. When they're a little dry, they're inflamed. Nice vicious cycle. So we can break that cycle. And how do we do that? Well, more importantly, when we start to see patients that are developing a little bit of a granuloma or starting to get a little bit more inflammation, you want to concomitantly keep them on an anti-inflammatory, like an immunomodulator. It be cyclosporin, or whether it be something like a low-grade steroid like an Alrex or something like an FML. The key here is to control the inflammatory load to help our patients get better quality of vision. So for me, and to you, when you have a patient sitting in the chair, think of all the different things we can do. There's great plugs out there, and more importantly, they're simple to do. They're easy for the patient. It's something they don't have to think about when they go to sleep. And what we can do is help them stay with better quality of vision throughout the rest of the day. So for me here, hot Arizona, to you, wherever you are, I hope you guys have a good day, and hashtag LTD, live the dream. This is Marc Bloomenstein from Scottsdale, Arizona. Thanks.